Hey health hunters! If you run but don't experience foot pain, this video is not for you. Better yet, this world isn't even right for you. Go back to whatever planet you came from.
I bring you love.
Break his legs!
Now, when something hurts us, but not so much so that it inhibits us from going for a run, we don't seek out a professional opinion, whether it be from a podiatrist, an orthopedist, or a physical therapist, depending on the injury. In this video, we intend to give a quick guide to consult in case of possible injury, and thus, the more you know, the more equipped you'll be in finding the right solution. When it comes to running, occasionally we suffer minor aches and pains that disappear only to reappear more painfully a few months later, ultimately leading us to the dreadful outcome of taking time off running. The different foot injuries that runners most commonly encounter can be due to various causes: poor shoe selection, obesity, stepping technique that needs to be corrected, overexertion, and finally, poor physical health along with a sudden start of training without an adaptation period. To begin, we're going to differentiate the three parts of our foot from three different perspectives: the dorsal view, which is the instep, the medial view, which is the arch, and the lateral view, which, you guessed it, is the only part that hasn't been mentioned yet. Main causes of foot pain in runners. Now, we'll go part by part, starting with the common pains in the dorsal view of the foot. We have 1. Extensor tendinitis in the foot. Sometimes these tendons that we can see on the top of our foot get inflamed, causing pain, and although it's not crippling, it's still unpleasant. This specific type of tendinitis is accompanied by the pain and swelling of the entire top of the foot, slowly worsening after starting a run. A hallmark symptom is a snapping or clicking sensation when you move the tendons. You can hear clicks when flexing or stretching your toes. 2. Ingrown toenails, hemostosis, or toenail loss. 3. Dorsal corns. They first start out as red blotches in the aforementioned zone, but over time the skin starts to yellow and becomes hard and painful, hallmarks of what is commonly known as a callus. In the lateral view of the foot, we have 1. Peroneal tendinitis or tendinosis. This is pain on the outer edge of the ankle caused by inflammation of the tendons where they meet the peroneal muscles, which run down the outer side of the leg and meet in the middle of the lateral side of the foot and the sole. This is a common form of tendinitis in runners who have pes cavus, or a high arch. Number 2. Anterior peroneal astragalus ligament sprain, the most common type of sprain. 3. Sinus tarsi pain, not to be confused with tarsal tunnel syndrome, which occurs on the outside of the foot. Sinus tarsi is caused by various factors and manifests itself as a diffuse or widespread pain in the external side of the foot, which can radiate when we run, especially on uneven terrain. In the medial view of the foot, we have 1. Tarsal tunnel syndrome, an injury that is more common than the literature lets on. It is an entrapment neuropathy of the tibial nerve and its nerve branches within the foot. Number 2. HAV, those well-known bunions and/or hallux limitus, limited movement of the big toe. Both of these conditions are due to poor biomechanics and are derived from arthritis of the big toe joint. Be careful. Once the joint degeneration begins, there's no one who can recover the damage, but you can slow it down and even prevent more degeneration by getting to the podiatrist in time. Do bunions run in your family? If you're predisposed, you should undergo a biomechanical analysis to find out how to prevent corns. Sorry to be the bearer of bad news, but all you runners over 30 years old, you're better off bringing your kids because it's a bit too late for you. Other foot injuries. We don't want to overlook bursitis nor bone fractions. Bursitis is the inflammation of the bursae, the small fluid-filled sacs which are found in points of friction between muscles, tendons, and bones. They're like padded cushioning that improves movement. This inflammation is caused by excessive use of the joints. Who knew runners overwork their joints? Bone fractures are due to direct trauma or stress. The stress of having 3 kids on top of a full work schedule is not what we mean by the word stress.
No. Monsters.
But rather stress in the tissue due to abnormal repetition of bodily movements, along with excess strain. Running is a very repetitive movement, greatly impacting the skeleton of the foot. These fractures are most common in the metatarsals, which are the largest bones. Fellow runners, hopefully we've provided adequate information to identify what kind of injury you might have, depending on the part of the foot that hurts. Get well soon. Cheers to good health and many more kilometers. And that's all. We'll see you in the next video.